Now we bring in Dr. Julie Morita, Executive Vice President of the Robert Wood Johnson Foundation. She was also a member of President-elect Biden's COVID advisory panel. Doctor, thank you so much for joining us. Appreciate you coming on the show again. Let's start with vaccines for children. Is this shot appropriate for pretty much all children, or are there some kids who you would say you might hold off or hesitate on giving them the shot?
Yeah, so I think, Lindsay, what we've seen today is that the FDA, the White House has kind of revealed what their plan is for rolling out the vaccine if the FDA approves it, and also if the CDC recommends it. And so what we'll see next week is the FDA will consider the data and we'll see if it's actually approved for emergency use for children. What we're looking at is the age of 5 to 11 years of age. After FDA makes a recommendation, if they approve it, then it will be CDC who will then advise regarding how to use it and if there are certain groups who shouldn't get the vaccine or not. But that won't actually happen until the first week of November.
Understood. And as Whit reported, the children's vaccine will go not just to pharmacies, but to doctors' offices and even school clinics. Does that plan, that rollout, make sense to you?
Yeah, so as a pediatrician and also a former medical director for an immunization program in Chicago, we had this strong network in Chicago of healthcare providers who could deliver vaccines to children throughout this city, regardless of regardless of insurance status, regardless of where they live, their race or their ethnicity. We had a full complement of providers who could do that. And that same system exists throughout the United States. So the key thing from my perspective is really building on that system and enhancing it. And so to see that pediatrician offices, family practice offices, community health centers, pharmacies, a whole range of places can provide the vaccines. That's critical for us to get kids vaccinated as quickly as we can.
And on that point, you've done certainly a lot of work on health equity. Does this distribution plan raise any potential concerns about equal access?
Well, what we've seen play out with prior vaccination efforts, this related to COVID, is that it hasn't been equally distributed or equally as accessible. And what this effort is right now is building on a system that really helps to make sure vaccine is accessible to all children. So really focusing on community health centers, federally qualified health centers, vaccine for children providers who actually provide vaccines to uninsured and underinsured children. But there also have to be efforts to make sure that parents are educated, that barriers to administration of vaccine are really eliminated. And so all those kinds of things really need to happen so we don't see inequities and we don't see disparities in vaccine coverage.
And lastly, there is yet another COVID variant that has emerged out of the UK. Some people are calling it Delta Plus. How concerned are you about that?
I think we're fortunate that we have disease surveillance systems in place so that we can detect when these variants emerge. What we are seeing is really low levels of this variant that has emerged, and it's really important for us to watch and see, is this variant more transmissible? Does it cause more serious disease? And over time, we'll be able to have that information. But right now, what we've just detected is that it is present, and it's really important for us to keep a keen eye on what's happening with the variant.
Dr. Julie Morita, Executive Vice President of the Robert Wood Johnson Foundation, thank you so much. Appreciate your time.
Thank you, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.